Women waiting months for answers about the lump in their breast. Nurses rallying outside a Saskatoon hospital. Paramedics showing up at the legislature, begging for a break. Saskatchewan is facing some serious issues in its healthcare system, and we found out this week we don't have a lot of extra money to deal with that. For more on the latest, we've reached our political panel. Adam Hunter covers politics for CBC Saskatchewan, and Murray Mandrick writes a political column in the Regina Leader-Post. Hello.
Good morning.
Good morning.
Hey, Adam, what is the latest when it comes to diagnostics for breast cancer?
This is something we heard about, a few weeks ago, where patients were raising the alarm about having to wait a long time, way longer than is expected. And this week, the government announced that, they've heard those calls and they're going to do something about it, but they're going to send those patients, 1,000 of them roughly, to Calgary, to a private clinic to have diagnostics done, whatever they need. These are urgent cases, not the high-risk patients that are deemed. Those will be able to stay in Regina, stay in Saskatchewan. This is a problem that the health minister says is specific to Regina and southern Saskatchewan, that there's a lack of radiologists trained in this area. And so the backlog has piled up to the point where a normal wait is about 3 weeks. It's over 10 weeks in some cases. He says, Edward Hindley says that's unacceptable. And so they're spending $2 million to send these patients to Calgary and covering the bill for travel costs, which is approximately going to be about $1.5 million from now until March of 2025.
$1,500, right, for a patient and a companion to go for those appointments. Murray, what do you make of the government's response?
Well, I guess the upside is that moving forward and getting that test is going to eliminate the wait and the stress and the anxiety for women. Going to Calgary to do so doesn't really help much, though it kind of counters everything that they're doing. And I get the government's frustrated. I get that they look at it saying we're spending $7 billion and yet we're not getting any credit for the smart and good moves that we do. That was evident from Mr. Hindley, health minister, this week in terms of his rather testy responses to this whole question of why are we spending the money. But the question is, why are we spending the money, and why are we spending the money when we could have been spending it on other things that might have addressed this problem years, weeks, 2 months ago? And we'll get into that in a moment about the trail of people coming to the legislature and to MLAs and ministers' offices today saying the same thing they did last year and the year before, and saying the same thing about government, that they're not listening to this issue. If you want to look at it from 30,000 feet in the air and a more global look at it, we need an overhaul of our health system. We need someone to step in and take a look at all the things that aren't working. A Stephen Lewis type, someone like that. It's basically the same people who told them that the things weren't working during the pandemic because they have knowledge of how health systems work and what's needed. And saying, look, we need to convene a panel, not necessarily on assessing the latest federal policy, but what we're doing in this province that actually might eliminate health lists and these horrible situations with mammograms. Sure, we feel bad for the ministers, but I feel way worse for women that can't find a solution to this problem and finding that the only solution is a stressful trip to Calgary, and maybe the same situation just started all over again, but they've had to travel 700 kilometers for mere tests that they should have got here if we had a better running health system.
And Adam, the concerns of patients have been backed up by healthcare workers. Murray mentions a parade of them in. We heard from a paramedic. We've seen nurses rallying here in Regina and in Saskatoon. What is the latest that healthcare workers have to add to this?
It seems like a theme this week, and I know you mentioned the rally in Saskatoon with the nurses saying that they're at their end, that they've asked the province for help, they've asked for a special task force. The government hasn't addressed that. The government will say, well, we have a health and human resources plan. We're recruiting from the Philippines. We've heard from healthcare workers that they've brought into the province, but that isn't meeting the need that is on the ground right now, that there's wait times that are just excessive. We heard from a paramedic this week who had a 36-hour shift, and he said 27 of those were in a hospital waiting with patients. He couldn't get to calls, that there's 10 calls deep sometimes, that there can't be breaks for paramedics, that they're losing them to other provinces. The government isn't recruiting paramedics in the same way they're recruiting doctors and nurses. We also heard from medical imaging techs here in Regina who say that the Pasco Hospital could be put on bypass because certain techs are taking maternity leaves, leaving the profession to go to other provinces where the hourly rate is about $7 more in Manitoba and Alberta compared to Saskatchewan. And they say, cost of living's caught up. It's not a big difference, not a big advantage to be here. So when people see that number, they're going, well, I can make more money for the same exact job. I'm going to leave. They're saying this is all connected. That was the message from everyone, that if one thing falls, the whole tree falls. And we're seeing that evidence of that. That's at least what we're hearing from these people that are working in the hospitals right now.
Murray, how bad is this compared to what we've heard for decades in this province, which is that patients fall through the cracks. There aren't enough healthcare workers. I mean, speaking of a healthcare review, we've covered endless healthcare reviews, including by Ken Fike, which said put a lot more on the front lines into preventative, team-based medicine, close more real hospitals. Yeah. We're still hearing about the ones that were closed to stave off bankruptcy here.
Well, the way I look at it is every government comes through with new enthusiasm to tackle the healthcare system. We have a 16-year-old government, and I think the first 10 years they exhausted the enthusiasm under Brad Wall to tackle the health system problems.
Remember when he promised no wait times in the
ER? I seem to remember that
zero wait times. You just walk in and get emergency service.
Apparently that promise wasn't transferable to the next premier. But and this is sort of where we're having the problems. They've gotten to the point where they're falling into the old political trap is, woe is us, what do you expect from us? We're doing a fantastic job. Things aren't as bad. These are just isolated situations every now and then. No, they're not. It's, as you say, it's always something. But one of the big differences is past governments maybe relied too much on experts and too much on the advice of people from elsewhere. These guys obviously don't rely enough on not only the experts, but they don't have decent enough communication with the groups that Adam outlined that are coming forward to the legislature. And they're very frustrated. A lot of them are union groups, but some of them aren't. They're just basically frontline workers like the EMT that came to the House saying, yeah, I made the same points last year and the year before. Yeah, it's getting worse because the population's growing. So from that sense, we probably do need a fresh look, an outside opinion as to how to particularly handle this. What we don't need is government ministers basically saying that, oh, it's not really a problem, or I can cite a whole bunch of really good examples where things are good. Yeah, a lot of planes land every day, and we don't write about them. But you know what? When someone needs the system, they need the system, and when they don't have that system to meet their needs, then it becomes news in the story. This is not complicated, folks. Pretty simple concept. So let's look at how you can eliminate those problems, because it's a never-ending fight. And if you don't have the eagerness and the willingness to keep that fight up, maybe that's your problem as government right now. Maybe it's not everybody else's problem.
Something else that's a problem for government right now is that it's bringing in a lot less money than it thought it would. What's the latest, Adam?
Yeah, a lot less. A lot less, like over $1 billion less. The government projected $1 billion surplus just in March for this financial year, and in August, late August, the first update, we said, well, that's down to about $400-odd million. Now we're even over into a $250 million deficit projection. The finance minister says that revenues specific to non-renewable resource revenues, specific to potash, is down huge, over $500 million. Oil is actually up. So then that same actually story in Alberta. Taxation went up. So they're making more and bringing in more in taxes, but they're losing their projection in potash. On the expense side, it's crops. It's the drought that happened, over $800 million in crop insurance payments, and another $100-odd million for wildfire evacuation. So those are the two big two things that are related, obviously, when you talk about the climate. And so that's where the government's projection has been kind of knocked out of the water.
What do you make of this?
Well, yeah, a lot less. Like, I'm a lot less tall, handsome, and youthful. I protest those studio cameras, by the way.
We all do.
We all do. I see the frustration of government because, unlike others, I guess, have been critical of this, there is legitimacy to the unpredictability of crop insurance, of forest fires. We don't know how much every year. We know by now that they're going to happen, but we don't know how much. So maybe that the criticism for not anticipating how bad it was is a bit unfair, except for two things. They could have anticipated somewhat, and they anticipated zero. There used to be funds set aside, contingency funds for forest fires, for crop insurances that you and I covered back in the day. That was simply better budgeting. And to be quite frank, it would be very helpful for a government under pressure to cut taxes as soon as it announces it has $1 billion surplus and people are struggling out there. Of course, they're going to ask for their taxes being cut. But if they can make the argument, well, we're government and we need to set aside money for the unexpected, and we need to set aside money for debt repayment. And by the way, debt's going up to a record $31 billion in public debt. We're paying $822 million in interest payments, the credit card payment that we have to pay before we spend a dime on hospitals, schools, or roads. This is getting to be a huge problem. This was not a brilliant budget. It wasn't well thought out and well seen. Yes, there were issues in play, but they need to find a better way to budget.
You guys, thanks very much for this.
You're welcome.
You're very welcome.